My name is Israel Samaniego. I'm the clinic manager at the Cancer Institute at Pioneers Memorial. We offer comprehensive medical oncology care. Oncology is treatment of patients who have been diagnosed with cancer. So we offer medical oncology, which includes chemotherapy. With the actual chemotherapy, I think there's a lot of physical and emotional challenges that the patients undergo. Physical, the ones we know, fatigue, nausea, vomiting. Well, everybody knows. And then there's the emotional part, the navigation part, which is patients not understanding their diagnosis, having to navigate through this complicated medical system, resources that we may have available elsewhere, having to get them together with those other agencies. CRCD helps us kind of tie everything together. We, here at the Cancer Institute, we administer the chemotherapy, take care of the actual cancer diagnosis, get them in touch if they have any insurance issues, if they have any emotional concerns, it could be financial. They help us tie everything together. They're that bridge. There's a lot of limitations. We live in a community that's underserved. Many patients cannot go across this hill that we know of. So trying to navigate through the system and keeping everything local through CRCD navigators is great because they help them find those resources here locally. If necessary, if it needs and we can't meet those needs, of course, CRCD also helps us navigate outside if we can't find those resources here. The Cancer Institute works closely with CRCD. Like you said, we are professionals. We understand what cancer means. We help them go through these difficult times. Like I said, it's just not a physical, it's an emotional and psychological aspect of it in which CRCD helps us navigate through this complicated system. Our nurses here at the Cancer Institute, they're all oncology certified, and we take our time to give that chemotherapy teaching. However, there's a lot of emotional struggles that go through when the patients are within these four walls. And I think once these patients leave the clinic, they face that challenge of having questions. They want somebody outside of the clinic to help them understand what happened. The chemotherapy, why they're receiving the chemotherapy, helping them understand why they have to go to several doctors, helping them understand why they need chemotherapy just in general. And this is where we work closely with CRCD to try to help these patients ease that anxiety. So we just want to let everybody know that our doors are open here for anybody who seeks treatment. It could be anybody from the Imperial Valley or friends across the border in Mexicali. We want to thank everybody who's out there and helps CRCD with their donations. We have worked with CRCD for several years, and we can tell you that this money is put into great use.